Well, we've got a bevy of experts on the line today to talk about a really important topic. We've got board-certified physicians Benign Ghafoori, MD, radiation oncologist with Austin CyberKnife, and George Bobustuc, MD, neuro-oncologist with Austin Cancer Center. Gentlemen, good morning to you both.
Good morning.
Good morning.
Thank you both for being here. I know you're very busy men, so I'll let you get back to it here shortly, but I wanted to talk to you about May, which is National Brain Tumor Awareness Month. So, Dr. Bob, we're going to start with you. What exactly are brain tumors by medical definition, and are there different types of them?
They're abnormal growths within the cranial cavity because some of them do not really originate from the brain parenchyma. They could originate from the layers that are covering the brain. Or other organs within the intracranial cavity. Depending on their features in terms of growth, rather rate of growth, and what we actually find under microscope when we study these tumors, once we have the tissue, we could actually talk about benign and malignant brain tumor.
It's a scary thing to be diagnosed with, right? But there's a whole scale of diagnosis here. So let's talk about the difference between benign and malignant tumors. What are they? What do they do?
So benign tumors grow very, very slowly. They are usually very well delineated. They do not invade the brain. They do not create a lot of pressure-related problems. And because the rate of growth is very, very low, they allow the brain to actually adjust. So patients may not really have symptoms or symptoms to really get them worried for a very long time, as opposed to a malignant brain tumor where rate of growth is very, very fast. And depending on the area involved could give specific symptoms, or one could actually develop pressure-related symptoms. A simple headache that doesn't give someone a break becomes chronic. You go to bed with it, you wake up with it, and it's worse and worse, may be very significant in terms of a mass growing very, very fast and creating a lot of pressure inside the cranial cavity, as opposed to a localizing symptom where, depending on the area of the brain that is involved, one could have specific symptoms like weakness in one arm or one leg, or double vision, leading to a more obvious type of clinical pattern that would make somebody, talk to a doctor right away.
Some of those I wouldn't have even considered, weakness in a leg or something like that. This is why it's so important to have a yearly checkup, even if you don't feel like you're having symptoms. And I know from talking with y'all over at CyberKnife, Dr. Ghafoori, that metastatic cancer is a real concern. So Dr. Bob, if you could answer this as well. Let's talk about what metastatic cancer is and what it can do to the body.
Abnormal growths of other organs outside the brain that have the features of cancer that grow very, very fast. They also usually spread, and there is a certain pattern depending on organ of origin to this spreading. This has been a theory that people have been toying with for about 200 years, but in the early 70s, we actually understood that certain organs offer certain fertile soil for metastatic cancer cells depending on their growth factor constellation. So we know that colon cancer goes to the liver. We know that almost everything that develops outside the brain as a primary cancer may end up in the lungs before it ends up in the brain. So with almost every cancer, you could actually think through and really understand that there is a metastatic cascade that really takes advantage of the constellation of growth factors that is specific to every organ. The brain is a very fertile soil for a lot of cancers because it has a great variety of growth factors. A lot of different cancers could home in the brain simply because of this very complex variety of growth factors.
Let's talk about signs and symptoms of brain tumors. You touched on it briefly, but let's get into it a little bit more.
Location, location, and location. These are the signs and symptoms that are going to point to an area of the brain that is involved by that tumor. And it could be as simple as weakness in one arm or one leg, or it could be a more complicated picture where one would have double vision and ignore it for a while, and that double vision may be associated with a patch of numbness in the face or taste changes, and that is a little bit more complex in terms of locating the origin of that cancer. One could just have unexplained nausea, could start vomiting in association with headaches.
Okay, all right. So really something to watch out for to see changes in your body. Okay, Dr. Ghafoori, we're going to go over to you. Let's talk about how brain tumors are treated, because normally there are a couple of different approaches, right?
Yeah, so here in our neuro-oncology program, I have the great privilege of working with some tremendous specialists, including Dr. Bob, who is a world-class neuro-oncologist that comes to us from MD Anderson Cancer Center, as well as our neurosurgical colleagues. We make a very, very strong emphasis in our program to have a multidisciplinary approach. That means all of our cases are reviewed by a group of specialists that includes a neuro-oncologist like Dr. Bob, specialized neurosurgeons, neuropathologists, as well as neuroradiologists, so that we can have a really good plan and consensus on what's the best approach for each patient.
And I'm glad you bring that up, because hearing about CyberKnife for the first time was really eye-opening to me. I have had immediate, loved ones in my family pass away from cancer, and quite frankly, chemotherapy was a pretty drastic treatment to watch them go through. So let's talk about CyberKnife, Dr. Ghafoori. What is it, how do you guys approach it with brain cancer, and what do you do about it?
CyberKnife is a form of radiation called stereotactic radiosurgery, or SRS. It's a highly specialized device that's what we call a dedicated SRS device that is used to deliver extremely precise, highly focused, high-dose ablative radiation on targets that need to be treated, whether it's benign or malignant. We use it in both situations. And we work very closely with neuro-oncologists and neurosurgeons to determine when the best application is found. Now, sometimes CyberKnife is used before surgery, sometimes it's used after surgery, sometimes it's used instead of surgery, depending on the clinical scenario. The benefits really of CyberKnife are that it's a non-invasive treatment. Even though it has the word knife in it, it's kind of funny, most people wonder about that. It's supposed to be a non-surgical treatment. And that makes it very useful because in these situations, particularly in patients with malignant cancer, a lot of times you can achieve a really good balance in delivering a highly effective treatment non-invasively with minimal impact on quality of life.
It's pretty impressive. And I know that the machines y'all use in conjunction with CyberKnife, I mean, it is cutting edge medical technology. Let's talk about something that Dr. Bob was discussing, metastatic brain tumors and maybe recurrent brain tumors. Can CyberKnife still help out in those instances, Dr. Ghafoori?
Yes, absolutely. CyberKnife, broadly speaking, in fact, is actually used for both benign conditions like meningiomas, pituitary tumors, schwannomas, things like that, that are growths and cause problems but are not cancerous, as well as primary brain tumors and metastatic cancer that goes from outside the brain to the brain, like from lung cancer or breast cancer or something like that. And in the setting of a recurrence, it's actually one of the most useful tools, because a lot of times patients have already gotten surgery in the past and may have also gotten radiation therapy with other techniques, and doing repeat radiation, particularly in the setting of recurrence, can be very complicated. And that's a scenario where CyberKnife is probably one of the best tools that's available because it's generally a situation where the prior treatments sometimes limit what kind of other treatments may be available, and it's an area where CyberKnife can really come in very useful.
Absolutely, world-class cancer care, decades of experience between all these doctors getting in together, and obviously patients being top of mind. You two really are the experts. Thank you both so much for your time this morning. We really appreciate it.
Thank you. Thank you.